Hello everybody, welcome back to my channel. This is Dr. Neha Taneja, a public health specialist by profession, but a mentor, educator and guide by passion. So this is our second episode on the new pattern-based PSM MCQ. So we'll just be looking at 4 MCQs today, which are actually conceptual MCQs that could come for your NEETPG examination. Before that, I just want to tell all of you that I usually go live on an academy platform for this particularly for this time of NEETPG just round the corner. Every day I'm going live on an academy platform at 10 a.m. every morning, Monday to Friday, for image-based revision capsules chapter wise. Okay, so these are absolutely free classes. You just have to download the app, click on NEETPG or the links that I share on my Telegram groups and Instagram groups, and you can join these classes every day absolutely free at Monday to Friday 10 a.m. Tomorrow, which is a Sunday, I am going to do a class on all recent updates in PSM on 21st of March 9 a.m. So this is particularly useful for NEETPG, FMGE aspirants and university students also to know what have been the recent updates which have been included in PSM for these upcoming examinations. Anything which has been added new will be discussed. I also go live at 3:30 p.m. on an academy platform where I conduct live quizzes with discussion based on mixed bag PSM MCQs. Both conceptual and PYQs are covered. All right. Okay, so let's begin the session for the day. So the first question, a study was undertaken to assess the malnutrition among young children. A sample of 100 children was selected from the rural areas and urban areas. Out of these, 40 children among rural and 30 children among urban were found to be malnourished. Which of the following statistical test is used to compare the data? So this is your question for tests of statistical significance. So whenever we have a question on tests of statistical significance, you have to look at two things, whether you are comparing quantitative data or qualitative data. Based on that, you have two types of statistical tests, okay, parametric test and non-parametric test. So here, if you have to compare quantitative data, all right, quantitative data, and you have to compare what? You have to compare, you're talking about quantitative data and you have to compare means and standard deviations, you will use parametric test. But if you are talking about qualitative data, but you have to compare percentages and proportions, everyone, then we will be using a non-parametric test. So parametric test is for normal distribution, non-parametric test is for skewed distribution. So here, read this question. A study was undertaken to assess malnutrition. So malnutrition, is it a quantitative or qualitative variable? It's a qualitative variable. जैसे मैं यहाँ पे लिखूंगी malnutrition, okay, and here I'm going to write yes and no, and here is my residence. Residence में क्या हो जाएगा? Rural and urban. All right, so here I will be saying malnutrition and residence. So accordingly मैंने क्या बोला? Qualitative variables हो जाएगा. We can talk about percentage of children who are malnourished based on the residence. So we are comparing qualitative data. So now look at the options. Paired t-test is a parametric test. So this is out of the option where you compare means and STs in one group before and after treatment. Like mean hemoglobin in a group of dengue patients before and after treatment. ANOVA over here is more than two groups, right? जैसे unpaired t-test is for means and STs between two groups, okay? ANOVA is more than two groups. Standard error of mean, like I've taught you, is a measure of dispersion. So we were left with one chi-square, which is a non-parametric test, and this is used to compare percentages and proportions in two or more than two groups. Understood, everybody? All right. So this question was very important, tests of statistical significance. In subsequent sessions, I will also be discussing examples of these different types of tests. Next question. A survey report in 1960 concluded that there was an increase in asthma deaths with the increased use of pressurized aerosol bronchodilators, although the deaths were more because of severity of disease. This association is spurious, temporal, indirect, consistency, or coherence. Now, see, what are we saying? That asthma deaths इसलिए हो रहा है ज़्यादा, there are more asthma deaths because we are increasing more of pressurized aerosol bronchodilators, which is actually wrong. The deaths are happening because of severity of disease. So this is a false association. It's a wrong association. That is why it is spurious. All right, like we say, there are more maternal deaths. Okay, there are more maternal deaths in hospital deliveries, okay, than in home deliveries. Now, is it a correct fact? This is actually spurious association because whatever cases go bad in a home delivery are then brought to the hospital. Therefore, this is a spurious association. Temporal association means this is Hill's criteria. Cause precedes effect. Okay, if you smoke, then only it will lead to lung cancer. This is best denoted by a cohort study design. Indirect association is like confounders. Okay, consistency, coherence are all Hill's criteria. Okay, this is also Hill's criteria. Consistency matlab, if I perform, the results are consistent. Okay, the results are repeated, whether I do it or you perform it. Coherence, the finding each other's, findings support each other results. So this was spurious. Next question. Which term describes the pattern of occurrence of 3 diseases? Now look over here, I've given you 4 terms and I've asked you which one describes. If you look at disease 1, ये क्या कहता है? 30 to 40 cases per week, last week is 38. Disease 2, fewer than 10 cases per year, last week is 1 case. Disease 3, usually no more than 2 to 4 cases per week, last week 13. Now look at the first one. 30 to 40 cases happen per week. This week it was 38. So it's within 30 to 40. That means it's a endemic disease. It is constantly present in that area. Next, fewer than 10 cases were happening per year, but last week only there happened 1 case. ऐसे year में less than 10 cases are happening, but last week happened 1 case. So this becomes, it's like we cannot tie the dots here. It's like irregular occurrence or haphazard occurrence, all right? So this becomes what? This becomes a sporadic disease, haphazard occurrence of the disease. Then disease 3, usually there are no more than 2 to 4 cases per week, but last week what happened? There were like 13 cases. So usually 2 to 4 week cases होता है, but last week 13 cases हो गया. So this becomes what, everybody? This becomes the example of an outbreak. Are you clear? Usually 2 to 4 cases होता है, but this time it is in excess of or more than 2 standard deviations. So mean plus 2ST. Isn't it? The number of cases has become double, right? So this becomes an example of outbreak. तो यहाँ पे क्या हो जाता है? Endemic, sporadic and outbreak. What is pandemic? It's a worldwide distribution. Alright, let's have a look at one more question for the day. After applying a statistical test, an investigator gets p-value as 0.4. This means the probability of finding a significant difference is 0.4. The probability of declaring a significant difference when there is truly no difference is 0.4. The difference is not significant 60 times and significant 40 times. Power of test is 60%. Now, what is p-value? P-value is the probability of committing a what? It is the probability of committing a type 1 error. What does type 1 error mean? It means that my null hypothesis is true, but it is rejected. Means that there is no difference in the treatment of a disease between 2 drugs, but based on the result of a clinical trial, I have rejected it and launched my drug in the market, which is actually not better. That means I have shown a significant difference when actually there is no difference. So that is the meaning of this statement, which is option B. Is it clear, everybody? Okay. After applying p-value मतलब probability of committing a type 1 error. Type 1 error क्या होता है? Null hypothesis true है but rejected. That means there is no difference in the treatment of a disease between two drugs, but based on the result of my clinical trial, I have rejected it and launched my drug in the market, which is actually not better. So I showed a significant difference when truly there is no difference. Okay, so this I might have done by chance also. Okay. So that is one question. Power you can never comment from the p value. क्यों? क्योंकि power of a test क्या होता है? It is 1 minus beta. So to comment on the power, we need the beta values. Okay. So this was a short session on some of the conceptual MCQs. I hope you've enjoyed the session. I'll keep coming with these type of questions. Do join me tomorrow at 9 a.m. on Unacademy platform for the free class. Okay, on recent updates on PSM. All right. Thank you so much for watching, everybody.